Our topic for today is a maxillary sinus lift, the techniques, indications and contraindications. So a maxillary sinus lift is a procedure by which subantral augmentation by inserting a bone graft between the floor of the sinus and the sinus mucosa provides the necessary amount of foundation for the installation of endoosseous implants. This is a well-accepted surgical procedure for the treatment of atrophic posterior maxillary alveolar bone. Literature research on the subject shows that the technique of the lateral window of the sinus elevator is a relatively simple procedure with good results. The degree of resorption of the alveolar bone directly affects the planning of the surgery techniques of the sinus augmentation and the application of the most suitable material for grafting. Indications can be implant placement in the area of insufficient bone volume, oroantral fistula closure surgery, reconstruction of the alveolar cleft, leaf 4-1 fracture. And contraindications are radiation in the head and neck area, sepsis, uncontrolled systemic disease, malignant diseases in the terminal stage, maxillary sinus infections, odontogenic infections, and pathological lesions. The lateral window technique is after local anesthesia, an incision is made in the mucoposterior flap, is lifted and the bone is shown. The bone is prepared with a diamond drill bit on the front wall of the maxilla above the planned implant site, thus avoiding perforation of the mucosa. After that, we expand the preparation opening and separate the mucosa from the bone bottom of the sinus with a curette. The bone graft is placed in a created space. The implant is placed at the same time or after the graft has healed. In conclusion, sinus lift techniques is widespread among clinicians, is very often implemented and shows very good results, provided that the basis principles of the technique are strictly adhered to. The risks involved are small, with possible post-operative complications that can be treated with medication and/or surgery.